Hello and welcome to episode 8 of the Wor Wellbeing podcast. I'm joined today by Louise Swash from the public health team. It's lovely to have you here, Louise.
Thank you.
Thank you for coming on. This feels like kind of like part 2 of the public health podcast because we've already had your colleagues, Stephen and Lewis, on, who gave us kind of quite a general view of what your team kind of do. And I know you're here to talk a little bit more specifically today. So I just wanted to ask you first off, just do a little bit about your role within the team.
No problem. So I've been in the team about 3 years and I've worked on various initiatives, starting off with the management and development of our health coach service. So the health coaches are staff who support patients to consider a lifestyle change, be that stop smoking or reducing their alcohol intake. It might be things like becoming more active. And they also help them connect to different services in the community that can support their health and well-being. Currently, I'm responsible for the Northumbria MECC programme, so that includes training staff and supporting them and particular services to embed the MECC approach. And I also get involved in some shorter term projects and work to raise awareness on services and support for patients in the community. So MECC is fundamentally about using all of those everyday opportunities to encourage people to engage in a healthier lifestyle. So that might include an interaction which helps somebody become more active or reduce their alcohol intake. So it's really all of the lifestyle risk factors and behaviours that we can support somebody to make a change in. So the MECC approach is about behaviour change, and that's done through raising somebody's motivation and their confidence. It's encouraging patients to make that change and supporting them through the process. And it's also about information sharing and effective signposting, and for that we use the MECC Gateway within the organisation. MECC really isn't meant to be an additional piece of work. It's meant to be an approach which is built into everyday interactions, and it's surrounded by the concept of asking somebody about their health and well-being, assisting them with a little bit of information to make a change, and then acting to promote a healthier lifestyle.
Fantastic. And I should say, because I think, I'm not sure if I missed that, but I think I missed out on saying that MECC stands for Making Every Contact.
Just indeed, it
I
does.
should have said that at the start. So in terms of if employees, if staff who are listening to this want to find out a little bit more about MECC, is the training on offer specifically?
Yep, absolutely, yeah. So we offer a range of training opportunities for all of our staff. So there's regular core MECC sessions, which are an hour and a half long, and they take place each month. And they're available to all trust staff, and they're mainly face-to-face, but we can offer virtual sessions as well. So within that training, we focus on health inequalities and some of the wider determinants of health that we know influence people's lifestyle behaviours and their health outcomes. We also look at some local data in terms of what's happening in our populations. We look at behaviour change and then some of the lifestyle risk factors. How can you ask a question? How can you approach the conversation? And also, how can you support somebody around them? So we can also deliver bespoke MECC training for particular services. So that's done on request, and we would work with a service to tailor the different case studies and examples and generally the content where required. And we deliver MECC training through different educational pathways. So we've got sessions on our preceptorship programme, community nurse induction, and then if staff want to become a health and wellbeing champion, MECC training is part of that programme as well. If staff also want to go on to become a MECC trainer themselves and cascade the information to their own teams, that can be done on request as well. And that's a half-day session where staff are supported to deliver core MECC to their colleagues. And all we need is an agreement signed by them and their manager.
Okay.
And then all information on the training offer can be found on our MECC portal under M on the intranet and on Calidus.
Fantastic. I think it's so important. I remember when I did it as part of the Health and Wellbeing Champions training. It's just so interesting, and it's one of those things, isn't it, that we're all kind of having those conversations day to day about health in various forms, and it just equips you. I found it kind of equips you with a bit of confidence.
Absolutely, yeah.
You know, bring things up with people and discuss things in a bit more detail.
Definitely.
So in terms of if you do some of that bespoke training with a team, what kind of impact can that have on a team?
Okay, so there's lots of different impacts, and that can be for individuals, it can be for staff and the wider organisation. So this includes things like having an increased confidence, as you've said there, about having these types of discussions, because sometimes it can be hard to know how to open that door. Some of these issues can be quite sensitive and quite tricky particularly if staff aren't aware of where to signpost somebody for that onward support. So having MECC training really allows staff to have a deeper understanding of the importance of having these discussions. So fundamentally, we would do it to reduce health inequalities in our local population and try and address the impact of some of those wider determinants of health. So staff will hopefully feel more able to deliver those healthy lifestyle messages and offer that encouragement for people to change particular health-related behaviours. And then it's also that knowledge base, that awareness of local services to signpost patients too. And I would also say it's important to remember that MECC is for everybody. It's not just for the benefit of patients, but having that training can help support our own health and well-being and that of our colleagues. So an all-rounder, really.
It is definitely, even if you're not in a patient-facing team, it's going to be so useful for you to have those conversations with your colleagues. So I remember you saying at the kind of start of our chat that it shouldn't be something that's standalone.
Yes.
It should be something that's kind of embedded. So are there plans in place to kind of embed that further within the organisation?
Definitely. So staff will probably be aware of our MECC programme. It has been going on in the Trust for several years now. And initially we had a real focus on training delivery and upskilling staff with that knowledge, skills and confidence. So although that's still happening and, it will continue to happen for the foreseeable future, we're now looking at how we can embed and evidence those MECC principles and really look at what impact it's having across the Trust. So we're currently working with different teams to look at their patient journeys and where there's opportunities to use the MECC approach, such as in assessments or home visits and the various routine interactions that they have. Providing them with resources and additional training if it's needed. We're also looking at our environments to see where we can have visuals and information that might nudge somebody towards making a behaviour change, and that might be when you're sitting in a waiting area, for example. And we're also trying to support staff further with the launch of some additional resources which will help them use the MECC approach. So we've got a guide which gives information on the different lifestyle risk factors and suggested conversation starters. We've also just filmed some trust-specific training videos that staff can use and really relate to those scenarios and those settings when they see their colleagues in action. And we've also got some case studies that we want to share from staff who have used the MECC approach to make a real difference for patients. Once staff have had their core MECC training as well, they are invited to monthly update sessions, essentially, MECC monthlies. They're done virtually, and that's really just to look at those wider determinants of health.
So interesting.
So there's lots of really good stuff going on. We've had things like health literacy. We've got one on Friday around veteran support. We've got sexual health that took place a couple of months back. So lots of varied topic areas, and we've also got our MECC portal that staff can access all of that information on as and when they need it.
Fantastic. And what's the take up like? What's the engagement like with staff kind of wanting to get involved with that training?
It's definitely increased, I would say. Certainly over the last 6 months, there's been lots of really varied requests from services to have their MECC training. I think the word's definitely out now about the importance of the approach, and lots of teams are coming to us and asking for training to be delivered and wanting to work with us around making it more bespoke for their particular service.
Brilliant. I think, the more upskilled you can be, knowledge is power.
Absolutely,
and there's nothing worse than having those type of conversations and thinking, I don't know where, I really want to help, but I don't know where to send that person, where to signpost them. So I think it's fantastic for that. So That's
Definitely.
brilliant. Excellent.
Thank
I feel like
you.
know loads more about MECC now. So M on the intranet.
On the internet, yes. Yeah.
Go on and sign up and
Absolutely.
get all that training. That's fantastic. Well, before I let you go, the question that I ask everybody on this podcast, because it is a wellbeing podcast, is what do you do to support your own wellbeing?
I have just got a little rescue dog from Egypt. So she came across last week, and I've never owned a dog before. I've always had cats, but I do think animals are really therapeutic and really important for your well-being. So I would say now, instead of going for a walk on my own, I now take my little rescue cocker spaniel for a walk.
I've got so many questions though. Wait a minute. What's the dog's name?
She's called Kiki, so she came with that name. We did debate changing it, but she knows it, so I think it's going to stick.
And why did you get a rescue dog from Egypt? I mean, is that even happen?
Well, I saw her on Facebook at the turn of the year and put an expression of interest in, thought nothing would come of it. And then before we knew it, we'd passed the application process and they were asking us when we were available to have her land on our doorstep. So she had a bit of a trek. She flew from Cairo to Paris and then she was driven through the Eurotunnel and up through Kent and all the way up to the northeast. So she handled that really well. But yeah, she had a bit of a rough start. So part of it was just pure chance that I saw her. Part of it was because I'm a bit of a softie for it.
It was fate.
It was fate.
I've got one last question, and it's a stupid question, okay? But does she understand your commands? Is there a language
She
barrier?
does actually. I did think that she would be because she's heard a lot of Arabic.
Yeah.
But she's definitely now getting used to English commands.
Jodie.
She does indeed.
Good. Fantastic. Oh, well, that's lovely to hear and enjoy your dog walk.
I will. Thank you. Thank you.
Louise. And thank you very much, everybody, for listening as well. And please make sure that you like and subscribe if you want to make sure you don't miss out on any future episodes. Thank you.